Midwives are mostly confined to the delivery room. Their work is, however, not limited to the care of expectant mothers, but they also provide sexual and reproductive health information, family planning, counseling, and antenatal care. It is also their responsibility to care for newborns and post-delivery services. Hilma Shikwambi has been a clinical midwife for most part of her profession. She said a mother's trust in a midwife is the first medicine for a successful delivery.
Naturally I'm a nervous person, and I was not comfortable in front of a sick person. But the day I walked into a midwifery unit, I found my space. I just loved it. So this is where I ended up. Everyone will tell their stories, because the basic thing is that it's such a rewarding thing, seeing your life coming.
A life that in some instances may not survive is the worst fear for a midwife. Namibia's infant mortality rate stands at 39 deaths per 1,000 births, while maternal mortality deaths are at 358 per 100,000.
I have personally witnessed the maternal death, which I cannot tell what was the direct cause of that, but that was one of the worst things, when you see a woman walking in a maternity section and then unfortunately she could not live it.
Some of the main contributors to maternal and infant mortality are the long distances to health facilities, prolonged labor complications, and in some instances could be attributed to pure lack of skills.
Lack of skills is a problem. It's not necessarily that somebody deciding not to, but you are confronted with a situation thinking you are doing what you're doing, but actually it's not what is expected. So that is our current challenge.
Or sometimes the inability of a midwife to make an instant decision.
We were not empowered much to make a decision when you think that a decision you just made is not right, because it's either because your colleagues see you as junior or not in a position to make such a decision, and then you see a woman probably, this is not, maybe we could have done that, but you do not have that authority to say. So those are the worst days.
It is these skills gaps the Independent Midwives Association of Namibia was established in 2014, and its partners such as the World Health Organization, the United Nations Population Fund, and the Health Ministry aims to address and help midwives to reduce maternal mortality.